virus clashed Biden's policy as president chickened out cutting self-isolation for health workers. Boris Johnson warned Joe Biden's coronavirus strategy risked a huge surge in infections as he rejected demands to reduce England's self-isolation period. Last week U.S. health authorities reduced the number of days of isolation for asymptomatic cases from 10 to 5. The Centers for Disease Control and Prevention also said the asymptomatic people after isolation should follow 5 days of wearing a mask when around others. The U.S. made the decision to help reduce the number of people off work with COVID. With Omicron far more transmissible than previous variants, there have been fears that the strain's rapid spread will overwhelm key public services due to the number of staff isolating. Mr. Johnson has found himself under increasing pressure from backbench MPs and businesses to follow the U.S. and reduce the isolation time in England. However, speaking to broadcasters on a visit to a vaccination hub at Stoke Mandeville Stadium in Aylesbury, Buckinghamshire, he rejected the demands. In a thinly veiled swipe at the U.S.'s decision, he said isolating for just 5 days risked leading to even more people off work. Mr. Johnson warned a rise in the risk of transmissibility by reducing the isolation period could lead to even more infections and even more forced to quarantine. The Prime Minister said, "We'll continue to look at the infectivity periods, but the key thing is we don't want to be releasing people back into the workplace when they're still infectious. And the risk is you'd increase the numbers of people going back into the workplace who are infectious by a factor of 3. So you might perversely have a negative effect on the workforce, if you see what I mean, so that's the argument we're looking at." Britons living in England, Wales and Northern Ireland are currently required to isolate for up to 10 days, but can be released early if they return negative tests, lateral flow tests on days 6 and 7. Scotland is yet to follow suit and still requires all those who test positive for COVID to isolate for 10 days. American public health expert Samesh Adalaya, senior scholar at the Johns Hopkins Institute for Health Security, said, "The Biden administration should have explicitly articulated and adopted a harm reduction approach to COVID-19. Such a stance would help Americans learn how to risk calculate their activities around what is a ubiquitous and unavoidable infection. Harm reduction could be accomplished much easier with wider availability of rapid home diagnostic tests. These technologies make it so much easier for people to gauge the risks of social interaction. The supply constraints we now face are not excusable, were completely predictable, and had been evident months ago. The country and the administration needs to explicitly come to terms with the fact that the post-pandemic world is not 2019 but a world in which COVID-19 is ever-present but manageable due to the knowledge and tools, vaccines, monoclonal antibodies, antivirals and rapid tests, scientists and physicians have provided us." The biggest mistake the Biden administration made was to push a vaccines-only approach, rather than a vaccines plus, including rapid tests, improving indoor air quality, and distributing high-filtration masks ubiquitously, coupled with public indoor mask mandates for high-risk shared spaces. Vaccines only suffers from a key weakness: variants. And we have now seen this play out with Omicron. We have wildfire spread as our current vaccines do not provide sterilizing immunity, meaning, people can and do still transmit the virus effectively. Rapid tests can stop public superspreading by keeping very infectious people home. Better indoor air quality and ventilation/air filtration measures can pull infectious aerosols out of the air regardless of what variant they are carrying. And high-filtration masks can stop people who are contagious from exhaling as much virus in the air and prevent uninfected people from inhaling that virus-laden aerosol, regardless of variant. It feels like we are caught unprepared again. The CDC still won't address why respirators aren't being recommended or provided to the public despite a 2008 mask model by 3M that was meant exactly for a pandemic virus emergency. I wear a relative of that model daily, and it's very comfortable. By putting most eggs in the vaccine basket, we are where we are again.